Welcome, everybody. It's my true honor to celebrate with you our second annual National Disability Employment Awareness Celebration here at Disability Rights Iowa. My name is Catherine Johnson. I'm the Executive Director of Disability Rights Iowa. I am about 5'7", although right now I am sitting down while talking to you today, but I have kind of reddish brown curly hair. I am pale complexion and I have a lot of freckles, and I'm wearing a teal blouse. My pronouns are she, hers. Today we'll be offering American Sign Language and captioning for this video presentation. If you need the captioning, you will have to turn that on your computer screen. Before we start, I'd like to give a thank you to Caitlin Schultz, Danielle Workman, Katie Vandervoort, and our entire DRI team. Last year, in DRI's first inaugural National Disability Employment Awareness Celebration, we focused on COVID and the implications of long COVID. We had a panel of experts and individuals with lived experiences share their expertise and experiences with us. We felt today that this information continues to be timely and is exceptionally important to continue to share. DRI wanted to make sure that all Iowans with disabilities had the opportunity to participate and learn from the panel of experts that we shared last year. So we decided for our second celebration that we would re-release this panel conversation. We also wanted to make sure that everyone had the most up-to-date information possible on COVID and long COVID. So we asked our public health advocate, Danielle Workman, to provide updates to us. I'd like to give a special thank you to our panelists from last year who will continue to educate us this year. That's Jenny Tehan, Sonia Reyes, and Jean Hall. 32 years ago, Congress passed the Americans with Disabilities Act. This was a civil rights law. Congress intended to eradicate discrimination based on disability through enacting the ADA. The preamble of the law, which sets the goals for what Congress was intending to do, provides that Congress wanted individuals with disabilities to have full participation, equality of opportunity, independent living, and economic self-sufficiency. Employment is part of all of those goals that Congress set. Unfortunately, employment of individuals with disabilities continues to be significantly lower than that in the general population. One attempt to address employment concerns has been to establish October as a national month to recognize the contribution of individuals with disabilities in employment, and also to discuss what we need to do to continue to move forward to really truly reach the goals that Congress set 32 years ago when it comes to economic self-sufficiency and independent living. This year, we will continue our celebration of National Employment and Disability by refocusing our efforts on COVID and long COVID, particularly the impact that long COVID and COVID are having on our mental health, on the disability community, and on employment opportunities. And also talk a little bit about how COVID has changed our work-life balance and other aspects of our lives that are very different 3 years into COVID than they were before. It's important for everyone to understand that long COVID is considered a disability under the Americans with Disabilities Act, and that if you have long COVID, you are entitled to protections from discrimination based on long COVID, and also entitled to ask for an accommodation to work or to go to school or to attend an event. Our discussion today is going to be available on our YouTube. If you are interested in being one of the first people to see it, please follow us on our social media platforms. We will be releasing it through those platforms and giving you information on how to access that as soon as possible. So thank you for your attention today.
Hello, my name is Danielle Workman. I am a public health advocate for Disability Rights Iowa. I am a 5'4" female, white, with medium length brown hair. My pronouns are she, her. I'm speaking to you today to give you the latest updates, what we know about COVID, long COVID, and vaccines and boosters. Currently, the COVID variants that are circulating, that are the most prominent in our communities, are Omicron BA.2, BA.4, and BA.5. It is important to note that Omicron causes less severe illness and death in general, according to the data. Omicron spreads more easily than the previous Delta variant. This is why vaccines, boosters, and other safety precautions remain critical to lessen the impact of COVID-19. According to the CDC, updated COVID boosters became available for people's ages 12 and older in September of 2022. This booster is a bivalent, meaning it protects against both the original variant as well as Omicron BA.4 and BA.5. People should be aware that as COVID continues to persist, boosters will continue to be updated to protect against what professionals deem the most common or most dangerous strand. This will be a lot like following the same guidelines as the common flu vaccine, which is also updated every year to protect against strains that present the biggest concerns to public health. Vaccines continue to be the most effective method for protection against COVID-19. Those who are moderately or severely immunocompromised should access the CDC website for special guidance on how and when to receive vaccines and boosters to ensure maximum protection. The CDC still recommends masking in public places when social distancing cannot be effectively maintained. As we enter into colder weather, people will begin to spend more times indoor together. Thus, masking is still an essential tool in preventing the spread of COVID-19. In 2021, long COVID became widely recognized as a disability. Anyone experiencing long COVID may be eligible for reasonable accommodations requests under the Americans with Disabilities Act. Long COVID is described as an extension of the symptoms or experiences caused by having COVID in the past. If you are experiencing long COVID, you may be eligible for reasonable accommodations if your long-term side effects are substantially impacting one or more major life activities. Examples of major life activities include, but are not limited to, sleeping, running out of breath easily, having difficulty focusing, and more. Individuals with a mental health diagnosis or an intellectual or developmental disability are more likely to experience an adverse health effect from COVID-19 than those without. Individuals who are experiencing long COVID are more likely to experience an adverse effect to their mental health. Disability Rights Iowa is not a medical agency. We are not medical providers. Information shared in this video are for educational purposes only and do not constitute as medical advice, nor should the information be obtained through this video to be used as medical advice.